Hi, I'm Tim Mullett. I'm a lung cancer surgeon here at the University of Kentucky Markey Cancer Center. I grew up in the west coast of Florida, a small town where everybody knew each other. And early on, I wanted to be a surgeon because I liked the hands-on approach and immediate results that surgery could contribute. When I came to the University of Kentucky in 1996, I really started to develop an interest in lung cancer. I've been here because of this, because of really a desperate need to reduce the number of people being diagnosed with lung cancer and dying from this in this state. I remember going into a restaurant with my kids when they were small, and there were so many people smoking. We couldn't get away from the tobacco smoke, and I knew we had to find a way to do something about this problem. We had to do more for Kentuckians, so tobacco treatment and cancer became very powerful drivers in my career. In 2012, as an officer in the U.S. Army Medical Corps, I was called to Afghanistan, and I served there for 3 or 4 months, and on my way home I had a layover in Kuwait on Christmas Day, and I felt this pain in my abdomen. I was not sure what that was, but as someone who's done a bunch of liver examinations, I knew that that wasn't a normal liver. And so I got back to the States, went to the emergency room. The doctors did an ultrasound and a CT scan, and they showed me the images and large masses, lumps in my liver that were not supposed to be there. It was supposed to be smooth, and it's not. And so I knew this was not normal. So we got PET scans and other tests, and we began to see these bright spots that would show up on the images. When I arrived home on New Year's Day with my family, they said, "Dad, we're so glad to have you home." And I said, "Well, I'm glad to be here, but there's more to the story." So the first week of January was a biopsy that took me immediately from being Dr. Mullett or Colonel Mullett to being a 51-year-old healthy soldier, previously well, with now abdominal pain, a mass, and I was diagnosed with stage 4 cancer. And the reality is that the chances of survival of this kind of cancer can be pretty low. I got the results of the biopsy back, and it turned out to be a GIST tumor. It's a kind of cancer that starts in the digestive system, and one that had a type of mutation that had a particular gene that may be eligible for a targeted treatment. And that means that medicine was available to specifically affect this particular gene. And so for my treatment, I was taking a pill. With 1 pill a day, you can see that now this is all that's left, and everything else went away. So the reality was that the Cancer Center provided a bit of a rescue for me. It also opened the door for me to get involved in lung cancer research. For many years, people in Kentucky have been diagnosed with lung cancer at a late stage, when it's difficult to treat. So people for generations have thought that this is hopeless and they can't really stop them from dying. But we can move the needle in this if we can adjust death rates from these late-stage diagnoses to the early-stage diagnosis. And if we can move it into that group where it's much easier to treat and higher likelihood of success, this is huge. We really have an opportunity to move survival into a better place. And so people who are at high risk for lung cancer can get lung cancer screening. It's a simple CT scan, no contrast, very easy. People who've smoked a pack a day for at least 20 years or currently smoke, or they've quit in the last 15 years, or they're between the ages of 50 and 80. Basically, if you have been a smoker, talk to your doctor and ask them if you are at risk for lung cancer and whether lung cancer screening is right for you. So we started a research project in 2014 to help hospitals establish effective cancer screening programs and to encourage doctors to talk to their patients who need to get screened. And that's where it helps that I'm from a rural community. I know that you can't just show up in a community as an outsider and tell doctors how to do their job. You have to help them in other ways, through building trust and partnerships. That's why it's really so exciting that I've had the chance to work with our statewide affiliate network, with Markey's community outreach programs, with Markey researchers and partners across the state, to really try and find good ways to spread the word about the importance of lung cancer screening. So since these statewide efforts started, we've already seen some success. Kentucky has been a leader in this area. We're now the second best lung cancer screening rate in the country. The number of people getting screened has gone up, and the number of people diagnosed with late-stage lung cancer has gone down. In fact, the rate of late-stage lung cancer diagnosed has dropped 2 times faster in Kentucky than the rest of the country. And in the area where we are highest hit by this disease, in Appalachian, Kentucky, we've seen this rate decrease 3 times faster than the rest of the country. So this is very exciting. At the same time, only 1 out of 5 people who need lung cancer screening have gotten screened. So, of course, there's still more work to do in our state and across the country. And Kentucky is actually playing a large role in this. Having a cancer diagnosis of my own has impacted how I approach my work. In fact, it has really allowed me to understand more personal side of cancer diagnosis. It's helped remind me about how important it is to check with my patients and how they're feeling, to feel that sense of urgency when you're waiting for a scan and try and make sure that that time is minimal. I vividly remember the moment when I was first diagnosed and began my treatment, and this is when I needed my team the most, my family, my community, my doctors. And it took everyone's support and expertise to carry me through and keep me in a position where I could continue to do other things. And in the same way, when we all work together as a team across the state, healthcare, researchers, community, neighbors, together we can make the biggest impact and save the lives of more Kentuckians.